And we are live. TikTok live number 31. Here we go. 9th of September, 2024. Here we go. We're getting after it. Michael S. Lindsay Jr. joined. Dave92 joined. Huss joined. What's up, friends? Ask any question. Q&A session. This is TikTok live number 31. I'll be posting this on podcast and YouTube channels later on. All right. Yeah, we got it. There we go. Okay. We are up and running now. Excellent. Roxanne Alvarez joined. Danny Me joined. Juno Rain joined. Luke joined. What's up, Luke? Dave92. Where were you when you found out Mufasa passed away? I was at one of my family, a cousin house, and we were watching Lion King. Yeah, said Lion King was a good one, right? Lion King was a classic. Man, have you ever seen the Lion King play? I thought it's a phenomenal play. It's such a great performance to go to. Luke Prudential submitted dental school apps. There we go. Congrats, Luke. Well done. Hopefully you'll start to hear back about interviews within month and a half, I would say. That's when it kind of starts. September, October. Yeah, September, October. That's when they came in for me. And then for oral surgery residencies, applications really came in October, November. A lot in October. Let's see, I got 14, 15 interviews. Those 14, 15, they came in between, I think I got one or two in the end of September, most of them in October, and then a couple in the first half of November, if I remember correctly. Let's see. Ooh, I just missed it. Here we go. Nate Weiss, what was your DAT score, if you don't mind? I'm applying next summer. Yeah, my DAT score was a 21 academic average, 22 on the PAT. It was 24 in Orgo, 22 in General Chem, 20 in bio, 19 in math, and what else? What am I missing? Math. 20 bio, math and reading. One was a 19, one was a 20. So it all balanced out to a 21 academic average. Yeah, I think that's everything, right? The PAT pissed me off because the lowest score I got on all my practice exams was 26. And there was one where it's like a glitchy looking cube structure for the PAT section. And it was one on the practice exam. I swear, it was on the practice exam. That was the only one I had gotten wrong more than once. And I couldn't, because it was like a glitchy cube structure. It came up on the DAT. Yep. And I probably got it wrong again. I was very stressed when I took that one. Short on time and everything, Eric Gordon. What's up, Eric Gordon? By the way, the top 3 longest listeners, TikTok shows me who it is. And I put you in the caption in the top. So I'll be giving you guys a shout out, whoever's on the longest. Okay, Eric Gordon, I decided to change from pre-med to pre-law. I got a 168 on my LSAT. Congrats. I don't know the LSAT. I'm not familiar with the scoring scale or how that works, but congrats. I hope you're excited with your decision. Sometimes in life, you have to make decisions fast. They might not always be the right decision, but it's very important to have the self-awareness to recognize that is the wrong decision. And then you need to backtrack quickly, just like you quickly made that decision based on your intuition and the knowledge you had at that time. You find out it's wrong, you backtrack. If you're right, you have a step ahead, right? That's my take on it. It seems to work, at least so far. Noah, do you think it's better to go to a combined DDS/bachelor's or a regular route? No, go to a school, an institution that you're going to be excited to be, to go into school every day, to go in when you've been studying for over 130 hours that week, to still go in and do your, you know what I mean? Like that's what it's going to come down to. Okay. Why do you need to get your BA, combined DDS BA? You mean like the bachelor, you get a bachelor's in, an MPH, no? Is that the one you're talking about? Are you going to use the MPH? Then why are you going to put extra time towards a degree you're not going to utilize? I'm very point A to B. You know what I mean? Why? Oh, that's my alarm. Here we go. Gotta get ready for bed soon. User 7356. Are you doing a 4 or 6 year? I'm in the 4-year oral maxillofacial surgery residency. Same oral surgery degree. The 6 years, 2 extra years because they get their MD. We both end up doing the same oral surgery afterwards, right? The 6-year can be beneficial if you're going to go do a fellowship in head and neck, plastics, cosmetics, whatever it may be. Otherwise, 99% of oral surgeons do the same procedures, the MD or not. Brian, how long did you dedicate to study for the CBSE? Still questioning my future. I dedicated at least 3 months the first time I took it, and then another month the second time. I took it 3 times. The first time I didn't study for it. So the second time was when I took about 3 months to study for it, maybe a little more. Took it one more time. I only had about a month to study for it. That's the one when I got the score I needed. So it's a huge sacrifice. It's a huge commitment. I can't tell you how many parties I skipped, couldn't go to family gatherings. I can only stay a short amount of time studying at family gatherings. Like, yeah, I could go on. I don't want to be to death with that. Said, what did Meg say? Meg, where are you going? Meg said, how much longer for residency? About 9 months. Thanks for asking, Meg. Gotta keep the eyes on the prize, right? It's countdown time. Yeah, about 9 months. June 2025, I graduate. What watch you got on today? This is the Jack Mason Navigator. My boy Joe Frapalo. Shout out to Joe Frapalo. TikTok Live 31. All right. The Jack Mason Navigator. There it is. It's a pretty watch. The loom pops. It's like a Panerai. Yeah, it's nice. It's so simple. It's just got the time. There's no date. There's no diver bezel. There's no chronograph. But I love it. I really love it. It's so soothing. It's like simple to look at, and it's actually quite nice. I love watches, as you can see. And yeah, the loom is great. Eric Nguyen, what was your experience like taking the dental licensing board exam? Yeah, it's there's a couple, because there's the board exams. We had part 1 and part 2 when I was in dental school. And then we took the CDCA licensing board exam. That's the one where it's like 40-something states accepts it. And that one wasn't that bad, to be completely honest. More clinical, which is how I think board exams should be, right? Your job is to treat patients. You should probably get tested on treating patients, not taking an exam, right? Not either or, but both. And there needs to be clinical. But it went well. It went very well. Rachel Otto, will you be at the Amos meeting? Our office is flying out tomorrow to attend. Rachel, what's up? Yeah. I'm heading out Wednesday morning. So I'll be there Wednesday, Thursday, Friday, Saturday, flying back Sunday morning. Yeah. So Rachel, see you there. Come say hello. Sweet. Ava said, what should applicants do while waiting to hear back from dental school? Work, prepare for interviews, read books, listen to podcasts. I would try and shadow dentists. That work at the dental school you're trying to get into, right? See what I mean? Makes sense? It's a little trick. Keep that in the back pocket. Julian said, USG, bro, I'm doing a school project and need some help. What's a good debatable topic? Fluoride versus no fluoride. It's not debatable, but a lot of people on TikTok think it is. So there you go. Joe said, I'm learning Intro to Anatomy and I retain the information, but I can't seem to hold a chemistry orgo. Chemistry orgo was great. Great was Khan Academy and flashcards. If I knew Quizlet existed while I was back in college, I would have used it. But I basically studied the reactions for orgo using flashcards and like physical flashcards, like the index cards. But I would try to do it with Quizlet if it was today's day and age, right? Sam Stacks. Hey, Doc. What's up, Sam Stacks? What's going on? Brian said, Brian. Hey, Brian. Truckerman followed the live creator. Oh, thanks, Truckerman. Goat said, hey, I got a crown 2 weeks ago. Still super ache and pain, and now my ear hurts really bad. Interesting. Maybe you got some crown-like vein effect too, causing some exposure or dentin. I'm not sure. Or cement on it. But definitely a good idea to go back to that dentist that put on your crown and ask them what's going on. See what they say. User 735629. When are you done with your program? Do you have jobs lined up? I do have jobs lined up. June 2025. That's when I'm graduating. I'm super excited to graduate and to get to the Ames meeting this week. I just missed. What dental school did you attend, if you don't mind me asking? Yeah, guys, you can ask anything. Literally anything. Ask away. Ask anything you want. I went to Stony Brook Dental School. It's on Long Island in New York. Small dental school. It's the 3rd smallest in the United States. The smallest is Harvard. 2nd smallest is UConn. Harvard's like mid-30s. UConn is low 40s. And Stony Brook was low 40s when I went there. Now it's like mid to high 40s. So really good. Goat said taking painkillers all day. Goat said any idea what it might be? Yeah, that might be what it is. But regardless of what I say, I can't give you medical advice. I think it's best to get Ryan Davis is asking to go to the dentist that put on the crown. Ryan Davis just asked, what was your DAT score if you were comfortable sharing? Didn't I just 21 academic average, 22 on the PAT? I just said that before. User 7490 said, are you talking about the DAT? Yes, I was talking about the DAT. Travis said, dental assistant here. What's up, Travis? What's going on? I was a dental assistant too for an oral surgeon when I was in my gap year. Brian said, you don't understand how helpful you are in a world of OMFS, which I feel is so secret. Brian, also they did say that. I felt the same way. Dude, isn't it weird? Yeah, I felt the same way. Now you got a guy on the inside, right? You know a guy, Brian. Yeah, I felt the same way when I was applying. It's so hard to get good, I don't know, genuine advice sometimes. I feel like it is and it is, but I feel like widespread, it's so much more beneficial for you to just, I don't, I don't know. I want to get back, and it's fun. Like we're chatting, and I'm recording this for the podcast, and I'll be shouting out the top 3 listeners on it. By the way, I'll put in the caption. This is TikTok Live number 31. But yeah, Brian, thanks for asking. That's a really good concept. I like to have good discussions like that. And yeah, it's so interesting. There's so many little niches within healthcare in general that are so secretive or quiet or kind of to themselves. And yeah, in oral surgery, I don't agree with it. I'm not a fan of that. I'm not a fan of immature competitiveness. I really want to promote a genuine area within dentistry. And most oral surgeons are, right? But there's those few that, and you can say this about any specialty, right? But no, I don't know. There were 26 unmatched spots last year, the highest ever in the history of oral surgery. I care about the profession. I care about this specialty going forward. That's concerning to me. And no one's really, it was kind of being talked about a little bit. What was done though? Nothing, just like everything else when you see going like that, right? So I don't know. I'm concerned. And I'd like to talk about ideas on what happened, what's going to come of this going forward. And we'll see how that goes. But I don't know. I don't know if people really care about what I think or consider my ideas. Who knows? User 7490. I took the DAT and I have a good GPA, but I'm debating becoming a dentist and applying. Any advice? Yes, here's my advice. You need to shadow and observe dentists in your community, different specialists, different dentists doing different things, different practice settings, and get a better idea, right? It's a very long, strenuous, and it's a process that requires a lot of sacrifices. I would consider for you specifically, and good GPA, you took the DAT, excellent. You got to figure out if you want to do this. It shouldn't be an if maybe. You need to know. Okay, that's how it goes, especially in this profession, right? It can lead to a lot of mental health issues if you don't have a definitive plan. Meg, wow, I've been following you for a long time. Thanks, Meg. Awesome. What can I help you with, Meg? Ryan Davis, are you comfortable sharing your DAT score? I just did. It's the 21 academic average. It was the 22 on the PAT. It was 24 on Orgo, 22 on Gen Chem, 20 or 21 on Bio, a 20 on Reading, and a 19 on Math, or 19 on Reading, 20 on Math. It was whatever, one or the other. And it was a 21 academic average, 22 PAT. Okay. Beagle Mom shared the live. Thanks, Beagle Mom. Beagle Mom 3. Sam Stacks, would you prefer a small dental school opposed to a big one? Yeah, I did prefer small dental school. You get a lot more clinical attention, one-on-one attention with your faculty members is what I was trying to say. And yeah, and also the smaller schools generally it usually reflects in the specialty NASH placement. And it did work for Stony Brook. It does work for Harvard year after year, every year. I don't know about the clinical experience at Harvard, but I do know that they place and match very well. They have a strong match percentage in specialties year after year. And UConn does well too. So it generally works. That's why I wanted to go to Stony Brook, and it worked out for me too. Blank said, are you wanting to own a practice when you finish residency? I would like to. I am respecting the process of like a 2-year associate contract. And then from there, if you could prove that, hey, I want to be a partner here. I want to buy into the practice. Then and also not just going into work every day and leaving and asking to be an owner. No, like contributing to the practice and showing that you have a lot of value to bring to the table that wasn't there before. That's what a true material of a partner, I think, will bring, right? And you know what? There are plenty of residents doing already in residency what they're going to do differently. You just got to find it. Right? Josiah said, knowing what you know now, would you still choose a career in medicine? Well, I'm in dentistry. But in medicine, probably not. No, I would probably not go into medicine. Knowing what I know now, probably would not go into medicine. Dentistry, I don't know. We'll see. I don't know yet. I'm not working. But yeah, from what I see, just in residency alone of the medical side, I would not. I would not go the medical route. Dentistry route's definitely better still right now. And dentistry with the corporatization of, in dentistry, you're treating humans. You're treating people. And you need compassion. You need to sympathize with patients, right? And you need to deliver the best care possible that you can give. And what I'm getting to is this is not Amazon. You can't just return that package. It's not like Toys R Us where you can maximize profit margins. It doesn't work that way. You can only do it to a certain extent, but you can't start crunching the provider because that reflects in the patient care. And that's what goes on when you try to corporatize an industry like that. So the direction going forward of dentistry, the prognosis is, right? We're following the trajectory of medicine, and medicine did not go down a very good path. You ask doctors in the hospital, and the majority of them are not happy, okay? And yeah, it's concerning because dentistry is following that path. Where will it end up? I don't know. I'm not sure. We'll have to see. Brian said, if you don't mind, how comfortable, familiar the CBSE material before starting studying? You don't need to be comfortable with it at all. You just need to start and you just study your booty off. It's a lot of sacrifice. It's a lot of focus. It's a lot of mental fortitude to be able to sit down for 15 hours a day doing practice questions. I think practice questions are the most stimulating way to study, but doing them 15 hours a day, back-to-back days, that's very difficult. And you got to do that for sometimes months at a time until you get the score that you need, right? Brian, I feel like I won't know any medical material because dental school curriculum is diluted. Yeah, well, I mean, there's a lot of dental students in the same boat. So, you won't be alone. It's hard. It's an uphill battle, but you got to do it. We all did. User 7355629. Will you be in private or DSO? I will be in private practice. Yes. In fact, I have an attorney team that I work very closely with, and they're very expensive because they're very good, to make sure that if there was any even talking of a DSO at the letter of intent, that my contract would be voided. So, more or less, right? But yeah, so I don't want to be tied down to someone else's rule book, like in private practice, I'm not trying to create my own rules, but I'm trying to, like, when you have DSOs, you start to have red tape, right? And that red tape, some of it's good, right? A lot of it it's too much. How many stop signs do you need on a straight road? So that's my thing. And you see that in a hospital setting. There's so much red tape and it impedes progress. It starts to get in the way of patient care. It gets in the way of quality of life immensely. And a lot of red tape is good. Don't get me wrong. You know what I mean? Like, contain the diseases, kind of, whatever it may be. PPE is generally good. But then when you start moving instruments out of the clinic drawers into the hallway because it's a disinfecting violation, you've gone way overboard and crossed the line. Like, that's ridiculous. Carla said, hey, best resources to study for the DAT. It's been so long. DAT Bootcamp, you got DAT Story, you got Kaplan's books, you have DAT Bio books. That was one thing I did. There's so much to do. DAT Story, Crack the DAT, Crack the DAT, Chad's videos for the chemistry ones. That's a bunch right there. Have you been watching any football? I haven't been watching any football. I'm in the fantasy football league, and everyone pooped the bed this week on my team. So I do auto draft. I don't have time to watch preliminary season stuff and then pick my favorite players. I do auto draft every year, and then my season generally gets better as I go. It's like I monitor players. I look on the free drafts, and then I pick people up as I go. Lady Ult, Crier is the worst elevator change. In which one even is the? I don't call it Crier. Is that the crane pick? No, I love the crane pick. Try using the crane pick gently and carefully. You don't want to point it into the sinus. Try using the crane pick on a moderately impacted maxillary third molar. Comes right out. Beautiful. It's great. User 7356. What do you mean by 26 unmatched spots? Yeah, this last year, 2024, there were 26 unmatched spots in all surgery programs in the United States. Ari Laws. How do you stay in check with your profession, your body, and self-care? Well, you got to be firm about your own boundaries. You need to, I have a hard cutoff. At 8 o'clock, I won't start a workout. If it's 8 p.m. or later, I do not start a workout. Unless it's like some rare blue moon where I can sleep in the next one. You know what I mean? Yeah, 8 o'clock is now it's wind down time. In fact, it's 10:20 right now. I gotta get on bed. Yeah, 8 o'clock. It's wind down time. It's not time to go get amped up and do a workout or go for a run. Plus it's so late. You don't want to be going out in the city that late at night in the dark. Probably not a good idea. You know what I mean? Self-care. I have a nice wind down routine at the end of the night. I put on maybe some tunes, maybe a podcast. Now, a podcast, I start thinking again. So I put on some tunes, whether it be some nice jazz. I have a Spotify playlist called Apartment Jazz. That's nice. Try that one. Adam, Atton. He's pretty good. If it's a nice summer night, Odessa. Love the old Odessa. The first two albums, I think, right? But nice wind down routine. Get my lunch ready for the morning with the water bottle ready, brush my teeth, floss everything, take a nice hot shower. And I slowly turn the lights down as I go. So I'll turn a light off and I'll go do lunch, turn these lights off, go in the bathroom, turn those lights off, and I shower to candlelight. It's weird. It's sure. But look, if you haven't tried it, I'm telling you, it's super relaxing. It's so relaxing. It's just a nice, free balls. I'll do it again tonight. It's a nice wind down routine. It takes about an hour to get my clothes ready for the next day, get my workout stuff ready, stay lunch, water, brushing teeth and everything, and a shower and praying. And then I pray before I go to bed at night. And so as you can see, I'm super pumped about my wind down routine. Let me give you a little trick. Getting up earlier in the morning, you might be a little more tired during the day. And being tired is tough because it will affect your decision making capacity and speed. But having that anxiety and added stress of waking up on late or even waking up on time, that's stress. I have a lot of work I need to do in the mornings for startups before I go in, and it takes over an hour to do all those tasks. So I need to get up roughly an hour and a half to 2 hours early to be safe prior to going in. To keep in mind, and that reminds me now, I'll go till 10:30. I can go till 10:30. I don't need to get up till like 5:45, 6 tomorrow. I'll be all right. Yeah, I realize. I hope that helps. Evan said, if you could go back, would you go to med school and just do ENT? No, I would not go to med school. I would not do ENT. I'm so glad I went dentistry. I've seen plenty being a resident with all the medical and surgical services in the hospital, and I'm very glad I did not go to medical route. No, being miserable, just like they all are. And some of them are very happy and like oddly happy, like SSRI happy, which good for them. But I'd like to see everyone in the hospital super enthusiastic and excited and motivated to do their work every day, to learn more and to treat more patients every day. And unfortunately, they made it an environment in residency where it's just about survival, and it depreciates your own life like pretty dramatically. And it's kind of, Meg, just follow your journey. Just following your journey, what a sacrifice! Oh, thanks, Meg. And yeah, there's a lot of sacrifices, but don't let me. If you want to be good at something or excel in life, you have to make sacrifices, no matter what that is. I would just say, yeah, one sacrifice would be like working 36 hours in a row, which is illegal, but it's happening today in like the major cities of the United States where it probably shouldn't be happening because we have laws in place and we have plenty of people that need work and are interested and qualified. So I don't know. Sometimes, the world we live in can be confused. Sometimes the world we live in can seem so confusing because things are just upside down. You know what I mean? Have you noticed that? I feel like I see it almost every day. Ari Laz followed the library. Oh, thanks, Ari Laz. Are you going to miss New York City after residency? Well, after residency, I plan on moving out to Long Island, to my hometown, Smithtown, where I grew up, hopefully buy the house. And rather than waiting around trying to pay overpriced for a house that isn't perfect, I'd rather buy my home that I grew up in. Literally, I grew up there, and invest in that to build it into the perfect home that I want it to be. You know what I mean? Like, I don't need a mansion like this, but I would like, the things I had at home just to be a little bit better and nicer, not necessarily massively in size or gold all over the place. No, that's not what I'm talking about. Just like, hey, we should redo that table area on the deck. Or, what if we, just like little things like that. Let's remodel the garage a little bit to fit a Cybertruck, because I'm into this. I think the Cybertruck's awesome. I'm interested in driving electric. I really am. I think it's great for the environment. I think it'd be awesome. The car's bulletproof, so it's one of the safest things on the road besides an ambulance. Great to drive the kids to soccer practice and commuting to and from work. Seems to make sense to me, Yeah, so just examples like that. Teddy DeYorkie, I've been hearing more and more about jaw in a day. Have you ever had exposure to it during residency? Jaw, you mean teeth in a day? Teeth in a day is, I've done 13 full arches as of now. 3 zygomatic implant cases. And we had 2 IPS cases in, which is, I'll be going to that later. But question mark was, what was your, but Teddy the Yorkie, to your question, I plan on doing all NX cases all the time, as many as I can. I'm very prepared for it. I'm comfortable planning on my own. The harder, more difficult cases with less bone or with interesting anatomy, I can plug into the DTX software on my laptop, get a nice 3D model, see exactly where the nerve is bilaterally, and plant some implant placement. Yeah, I'm feeling very comfortable, and I'm excited to do this in private practice. It's a big part of what I want to do. What was your major in undergrad? I graduated from Stevens Institute of Technology with chemical biology. That was my major. I started my first 2 years at NYU Polytechnic School of Engineering. Now it's NYU Tandon School of Engineering, and the major there was biomolecular sciences. Brian Leclerc, do you have a favorite luxator? Yeah, I'm a big fan of the spade. I'm a very big fan of the spade. Now, I don't just go right to the spade. The spade is like my backup. Instead of going right to the drill, I go right to the spade and I get in there, right? I use like a shovel. I don't use like a shovel, but that's it, that. And then, you obviously go to the root tip pick if it's a root tip. If it's a ankylosed tooth or a chip or something, that's when I go to the spade. But, narrow, straight, maybe back action. Yeah, I like to watch teeth using those, getting mobilized. Sonny B followed the live creator. Awesome. Thanks, Sonny. And guys, by the way, top 3 listeners, TikTok tells me, I'll put you guys and give me a shout out in the caption of this. This is TikTok Live number 31, recording it on my podcast app right now. I'll be putting it up maybe a couple of days. It's getting pretty late. You know what I mean? Wait, I just missed. I'll draft. I'll draft for you, bro. Sports Talk TV. I'll draft for you. Yeah, draft for me, man. That would have been great. Anthony, my college offers a dental assistant program and I'm a pre-dental student. Should I do it? Well, it's up to you, Anthony. Like, are you interested in that? If you are, do it. But don't let it get in the way of what you do want to do if it's not. Bro Mandini said booster. Maddie said sterile. Maddie said sterile techs run the world. Yeah, why? Sterility is so important. But when you go overboard and pull all the instruments out of the operator and throw them in the hallway, I'm inclined to believe we're going in the opposite direction. User 12309, have you tried Densadrills yet? I don't know what a Densadrill is. Does Torres follow the live player? Thanks, Andres. Dro Mandini, D2 at NYU. Do you think I have a chance for OS or is it too competitive? It's very competitive. I'm not sure what your scores are and stuff, Dro, or where your ranking is or your GPA, whatever. But, I mean, you generally should have a chance at it. Come see me. I'll be in the OS clinic. Dro, come see me. Say hello. I'll be in the OS clinic mid-December through mid-February. I'll see you there. James Corney said, I'm a social worker. What's something you'd like to recommend learn to help my clients with their health? I don't know. We had a social worker recently help place a patient into SAR. That's like a rehab facility that some patients will go to after their hospital course for further rehabilitation prior to their going back to their normal daily life. And she was excellent in helping with the placement of the SAR, getting it expedited, and it's so helpful. It's so great to see, and it really helps out the patient well too when you could get them in a great facility that matches their personal as well as their family needs. So that's just what I see from the great social workers that I've had the privilege of working with. User 735629. If you don't mind sharing, what is the range in salary for OS that you've been seeing? So I've been seeing anywhere from, the New York Metro Tech area or, in the inner city areas, you see anywhere from like 325, 350 all the way up to, I've seen as much as 750, 800 starting salaries. Gotta be careful of it. Is that VSO? Is it Aspen Dental where they're going to make you work at 4 or 5 different offices a week that are 2 hours away from your house? And 10-hour days. Like, yeah, you can make a lot of money, but if you just want to be a slave to the system, you could go and do that. That's not something that interests me. I want to build something beautiful. I want to make a practice that patients are excited to go to, and feel comfortable when they walk in that door. With doctors who aren't going to rush them or going to take the time to talk to them and explain everything and make sure that all the questions are answered thoroughly and in a way that you can understand. You know what I mean? How many doctors have you met that are talking another language? It sounds like they're talking in like hieroglyphics. No, you know what I mean? So I get made fun of in my residency, my other residents, for taking too long in the consults. And I really don't care because I think that is where patient care begins. And even now, I think social media is the pre-consult, the preliminary consult, because you can meet me online before you meet me in person in the chair, right? In the dental chair, in the consult room. So, food for thought. I think the best patient care starts at the consult. That's my opinion. Load of lard. Hey, doctor, what do you think is underlying issue when it continues to wiping, but still no poo? I think you're doing it backwards, no? Oh, Mandini, I ranked 45th out of 365 in our class. Bro, well done. Congrats. 365. That is a East NYU Dental School is gigantic. 45th. Very good. It's up to you if you want to do it. If you want to do it, get the CBSE score. If you don't get the CBSE score in time, but you're still passionate about it, you really want to do oral surgery, do a GPR year, and during that year, study your face off for that CBSE score that you need, right? If you get the CBSE score and you don't match, do a non-CAD year. It shows that you have more interest, passion, dedication, and commitment. You see what I'm saying? That's my recommendation. Lady Alt Crier is East-West babes. I like that. Glory babes. Cute. Yeah, East-West are good. I like them for, say you're taking out a lower mandibular molar and half the tooth cracks, half the roots come out. You can get that East-West in there to get the other root out. Otherwise, you can also use the East-West for root tips are better, necks are better for this. That's been the best application that I've seen using it. But yeah, there's a bunch of things. How many days do you have off a week, and do you study when you come back home? Yeah, today I studied for 45 minutes, I believe. I study by reading the JOMS, and I figure out this new thing where I actually make questions on the JOMS as we go. JOMS is the Journal of Oral and Maxillofacial Surgery, and I get it once a month. And one of my attending, my favorite attending, I love him to death. Shout out Dr. O. And he reads the JOMS every month, as he has for, he's saying 30-something years while he's been in oral surgery. So he got me into it. And what I've been doing is I figured out a way to make questions on those articles so I can get the gist, the main facts, the main points of them, the key concepts of those articles, those research publications and jobs, and then study based on the questions later. And then I compile them and maybe I'll release them to the public soon. We'll see. That's how I do things. Joe Mandini, D2, yeah, what are your thoughts on all the food recalls in the US? Yeah, probably not good. If a food's getting recalled, probably not good. What was the most recent one? It was Listeria, right? I think wasn't it Listeria in something? I don't know. I don't eat whatever it was in, thank goodness. But dude named Dave, do you ever choose between med and dental school? Yeah, I did. I chose dental school because I started to get an idea what med school was going to be like. And thank God I didn't go med school. Joe Mandini, have you taken the CBSE yet? That's also, you're asking if Joe Mandini's. Yeah. Question, what is your religion? And if you're a Christian, what denomination? I'm Catholic. Yeah, I do. I pray before I go to sleep at night. I pray the rosary. I've been baptized, confirmed. Yeah, I think that all religions can get along with each other and share insights that the other might not have learned. And I think that's really good way to do it, to collaborate and to communicate those things, to have a professional and adult discussion on certain things. I think it's a good idea. Yeah. Some of my best friends are Jewish, and I've learned so much from them about life, about things. Anyway, 123 said, are OMFS spots open for international graduates? I'm graduating from an Australian dental school. Fortunately, most of them are not. Some of them are, most of them are not. You would normally have to repeat 2 years in an international program within a dental school to get your dental school degree and then reapply. Caroline said, what's the average CBSE score for OMFS residency applicants? So the score scaled and fluctuates year after year. And in the last 5 years, they've changed the damn score 3 times. And it's kind of so confusing. That being said, the conversion gets you back to the old scoring scale where it's about a 70 is a good score. The average is about a 55. A passing score is around somewhere between a 65 and a 70. Again, it changes. It's usually between 65 and 70. It changes. And then anywhere above that, to anywhere above 70 is a good score, right? And then higher, anything above 75, 80 are stronger scores naturally, right? Turkey has said, do residencies look at undergrad grades? There was a residency that I heard of that does. I don't know why they would. I don't see why it matters. Use their dental school, give them a good interview, ask them good questions, learn about who they are as a person as well as an academic, and rank them. You know what I mean? I think that makes sense, right? Carter, what kind of surgeries do you do in OMFS? Okay. All tooth extractions. Dental implants, big dental implant cases like we were talking about before with the all-on-X cases, the teeth and day, if you will. Second implants. Facial trauma. We do fractures. We sometimes, if you have an attending that has head and neck oncology special fellowship training, maybe you're taking out cancer of the head and neck. Yep. Like segmental mandibulectomy or maybe full mandibulectomy. Things like that. And trauma to the face is anywhere from really, the telescope to the clavicle, and usually we're doing it in the maxillofacial lesion. So we'll do the frontal bone, and right here, even back towards around the ears. So D1 student here, Aku, D1 student here, any general advice? Study hard, get ready. Get the to-do app, I would recommend organize your day in a to-do list and a schedule using the to-do app. It's by Microsoft. It's a little white square with a blue check. And study using Quizlet. That's my general advice. User 9026. Been in OMS for 30 years. Implants are great, but they fail because the patient's habits. Stick to 8s. Interesting. I appreciate that, user 9026. Stick to 8s. Huh. Interesting. Okay. Never ever 589 said, hello, how are you doing, doctor? I'm doing good. Thanks. Flank said, do you see many Cybertrucks in New York? No, you don't. I've seen a few. I've seen a handful in New York. Just saw one yesterday, actually, out on my run. And yeah, I love a Cybertruck. I want to get in black. I haven't decided between glossy black or black yet, but we're getting there. Who is that? Emily and Avi said, hi. Emily, what's up? We miss you. We miss you at, the public hospital that we were in the clinic at. Emily, I hope all's doing well. I hope you're liking practice and everything. I hope you got your spot. Are you working at your parents' practice? I'm curious. Lady, you're paying for a dental degree, not a dental education. Take advantage of what you can. That's what Lady Alt said. Cleveland said, what's your end goal? My end goal is to start a family. Be happy every day. wake up excited, wake up with a smile on my face to see my family, and spend time with them, to work for fun, but not give up all my fun to work. That makes sense, right? And to get more time back for living instead of working. That's my goal. So that's what my end goal is to slowly get more time back. And I think that how am I going to get there? So everyone will tell you what they want to do. I'll talk your ear off right now and let you know how I want to do it. I want to do it by working in oral surgery, making a decent living, investing, hopefully becoming a partner in the practice to grow a better opportunity for oral surgeons, not just myself. Grow a different practice model where it'll be a 2-layered structure, and that will afford the opportunity based off of patient reviews, overall patient reviews, like a lot of reviews, and I'm going to create something for that as well, rather than by just production or who was in the practice the longest. If you're getting bad reviews and patients still want to see you, you probably are not fit to be the leader or a leader of the practice, a prominent leader. That's my focus. So restructure the practice and stuff. With certain savings, I want to invest in startup companies, my startup companies, or startup companies I partner with friends and colleagues with, and hopefully some of them will do well, and that will generate. They're all mobile. They're all mobile companies, right? Virtual mobile, whatever companies, and for the most part, and to invest in them, build them, and eventually be making enough money on a daily basis where I don't have to work 5 days in the office. I can work 4 days and maybe 3 days in the office because I want to, because I do love doing oral surgery. And then around that time and the other days of the week to put more time into the starts to build and expand. And if I'm right, it works. I would like to make this practice model and replicate it for other models where it puts patients first by putting the provider first. And I know that there are practices out there that say they do that right now, but I'm not seeing it. If that, you know what I mean? And sometimes seeing is believing. Caroline, how many OMFS residencies did you apply for? I applied for 30, 40, I don't know. I found a lot of good ones and a lot of bad ones, and a few bad ones. Didn't apply to the few bad ones, applied to a lot of the good ones, and I got 14, 15 interviews from that, and did well, right? Here we are. Ellie said, any tips on wax ups of 8, 9? Based on the symmetry. Always symmetry, based on symmetry of the other. I wasn't really big on slowly adding the wax. I would just shove as much wax on there as early as possible and then carve it from there. That was my strategy. I know a lot of people like to add and dab and build, and no. Drop a slab of wax on there, let it cool, and then carve it out to what you're looking for. That was my thing. Joes, you have the best perspective on patient care. So happy that your patients have you. Joes, it's very kind of you. That's very kind. I hope gentlemen, what the hell is the CS score? So guys, this is my future boss. The CBSE score is the oral surgery admissions test that you have to take to get into oral surgery, right? Dro Mandini said, thank you so much. You got it, Dro. Andrew Struble said, I have 3 dental school interviews coming up. Any tips? Yeah, remember, interviews are a conversation. It's not a multiple choice test, right? So you're conversing with someone. It's that simple. You're having a conversation. Treat it as such. Be genuine. You know what I mean? It's not like rapid fire question, answer, stuff like that. Dana said, what's up? I'm from OSU Dental School, Oklahoma. Awesome. As a pre-dental mentor. Dana, what's up? Thanks for joining the Pre-Net Mentor Map. I really appreciate that. You're a part of something much bigger, by the way, as you probably know by now. And we have something big coming to you. We're going to start an ambassador program where affiliate companies that we sign up as you help mentor pre-dental students that need those services, those scrubs, those DAT prep courses, those loops, maybe they'll be. If they use your mentor code as you're being an ambassador, then you'll get kickbacks and we'll pay you for that. Okay. And I think that's the right thing to do, right? Now, you're not going to pay off dental school loans with it, right? But you'll have an opportunity to, pay the groceries here and there, the gas, whatever, the travel bill. That's the goal with that. AA2 the world A. Have you ever dealt with patient with overjet? If yes, what's the largest overjet millimeters you've seen? Oh yeah. The overjet? Oh, I've seen overjet more than a centimeter. I've seen underbite more than a centimeter as well, up to 15 millimeters, I think it was a year or two ago. Yeah. Question mark said, nice, I'm Catholic too, so you go to Mass every week? I don't go to Mass every week. I stopped going to Mass every week during dental school. It got much less then. And in COVID, I haven't gone to Mass like that since COVID. And you know what? I listened to a podcast. I try to make up. Look, you can't make up for that, right? I try to make up for it because I don't have someone to go to the Mass in the city. And sometimes I'm working 14 days in a row. You can't go to Mass when you're on call like that necessarily, right? I listen to the podcast Our Daily Bread. I listen to that every morning. every single morning. I listen to that. And that's kind of how I make up for missing out on, the word that they have, the teachings, the stories that they tell me related to daily life currently and events at church on Sunday. That's what they do in our daily bread every single day. So while I not be being there for, 45-minute, an hour mass, which I would like to be, can't do that necessarily. I make up for that with 7 teachings throughout the week. So that's my little give and take thing. Joyce, how do you feel about general dentists performing all on X without going to an OMFS residency? Well, you have prosthodontics doing them now. You have periodontists that are doing them. Well, my answer to that would be another question. All complications in dentistry, all of them, end up going to the oral surgeon down the line. All of it. Everything ends up with the oral surgeon in the hospital, what have you. And one of the most invasive surgeries that a general dentist has been allowed to do, I guess, is the all-on-X procedures. Not anything more invasive than that, because you're not allowed to do LaForce and Vias as a general dentist. The next thing are these all-on-X, the zygomatic implants, and you're a general dentist doing them. But we manage the complications. So I'm not, as a patient, who do you want to go to? Master, IHVP, DS1, holistic is an opportunity to specialize. You could do it. Master, follow the life period. Thanks, Master. You could do it. You got to push. All right, friends, we're going to have to wrap this up soon. All right, rapid fire. Here we go. Rapid fire. Let's do this. This will be fun. Nicole, 1 month into my D1 year. Any tips, suggestions? Yes. Quizlet for studying and To Do. That's an app by Microsoft. That's good for to-do lists and scheduling. Joe Mandini, do I need to do research to get into OS? No, you don't. Zach, thoughts on stats? Major being pre-dental? Yeah, it could help. It can be beneficial. Make sure you're getting those pre-med courses in. Question mark. Can you get a religious exemption, go to mass? Probably not. Definitely not. JFC, hi doc, are you dentists allowed to sedate? What are your thoughts on this topic? Yes, apparently they are. In some states, they have certifications for general dentists to do sedations. Light, conscious sedations. If you give enough of those medications, you can kill someone, though. I would be very careful with that. Brandy, Michelle, I haven't seen your videos in forever. Have you been doing videos? Yeah, I have. They don't get as many views, and I had to adjust content a little bit, but I like doing the lives. This is fun, and I put it out on podcast. That being said, I'll be shouting out the top 3 people that listen to the lives. TikTok shows me them, and I put you guys in the caption. Humana.org. Do you know people at UF? I do know people at UF. In fact, I know Tiff, DMD, Tiff. Yeah, you could say we're friends. I know other people there too. A lot of my friends there graduated, unfortunately. Overall thoughts on the tree oversight? That's going right over my head right now. Joe Mandini thinks stock C in the winter. Nonamani 202020. What were your undergrad stats? 3.6 GPA. I got a 3.8 from Stevens and a 3.4 from NYU Poly. So it averaged about a 3.6 GPA and I got a 21 academic average on the DAT with a 22 PAT. Brandy Michelle, and I did get a 4.01 quarter. So my initial senior is my first semester not playing basketball, and I got a 4.0. That was also good. And I party too. So work hard, party hard. It works. Brandy Michelle, dang, I've been looking for you forever. It's so good to see you. Thanks, Brandy. That made me smile. It made my day. Thanks, Brandy Michelle. Question mark, is there medicine hospital for the sick? I don't think so. There is a brother. There's a brother priest that walks around. Effortjit said, do you ever get anxiety before going to work? Oh, sure. All the time. Especially the last couple of years. Yeah, unfortunately I do. And I found that getting up earlier to make sure I get all my tasks out of the way before going in kind of clears the plate and it allows you to kind of calm. It really clears off the stress anxiety before you go in. Rollo J4 said, nice hair. Thanks, Rollo. Rollo shared alive. Thank you. John Lewis, I'm currently D1 in Missouri. Any advice for first year, especially the exams and clean? Yes, study using Quizlet with the figures. That's my recommendation for studying. Get reps in. 2 is use To Do. That's an app by Microsoft. It's a to-do list, a calendar, a scheduler, all in one. That's the best thing you can do. Olivia Speecher said, will ENT have to drain it? Have to drain what? Infections? We drain infections all the time. Frank, oh my God, guys, I can't, I'm out of breath. Frank, tell the DDS lab owner here, do you think it's worth going back to school and becoming a dentist? Generally, some labs have a greater return on investment than dental clinics, at least right now, or that was 2 years ago, 3 years ago that I had heard about that. So I don't know right now. I'm assuming it's pretty close to 3 years ago. So I would consider that, Frank. I would expand on practices. I would open up labs. I would open up another lab before I would go back to become a dentist. That's what I would do if I was you. Kennel, how are relationships in dental school? They're tough. They're much more doable than in residency. I will tell you that. JFC, residency is very difficult. Better off being in a strong relationship than not being in one, for certain, during residency. During dental school, I didn't want to be. I ended up not being in a relationship for 2-3 years. Yeah, a little over 3 years of Yeah, about 3 years of dental school, and it was dual. Not conducive, but dual. JC, what's the overlap procedure between OMFS and ENT? A lot of facial trauma, a lot of things there. The nose, that's a big one. We don't do eye stuff. We don't do ear stuff necessarily. TMJ, they don't repair. So, yeah. User 885 follow live creator. Also, thank you, man. There are procedures use per panel for shaky hands. I would imagine some do. I don't know anyone that does. User 0164 said, "What is your advice on dealing with stressful hard times?" And speaking of that, exercise. Exercise is a big thing. Getting to bed early, keeping good diet, nutrition is very important as well. Those are some things I would say. Hard times in life. Speaking of that, talk with someone. Spend some time with someone that you trust and is near and dear to you. Talk with them on the phone. That's another big thing that I would. Cyrus, did you have any free time during dental school, especially D1, D2? Very little. Very little time at all, if at all, during D1, D2. Brittany, Michelle, you're doing amazing reading every single comment. You guys keep doing more. Come on. I gotta go to bed. Brittany, you guys are so funny. John Newen, what is the hardest year in dental school for you? D3. D3 year is the hardest just because you're getting about the same. You're going from 100% to about a 75 amount of classes, but now you're adding on 4 days of clinic a week. So now that really just piles on top of each other like a HQ, what do you think about orthodontics as a field? I really enjoyed our one orthodontics class in dental school, and it went really well. It didn't take much time for me. I did things they said really well, and I enjoyed it. User 0164, thank you for answering. You got it. Frankie Dedelis, did you specialize in a particular field? Yeah, Frank, this in June, I graduate oral maxillofacial surgery residency, so I'm in oral surgery right now. Dan 555000, thoughts on NYU Dental? Big school. Big schools generally get less attention to each dental student, right? It's just math. Nick, what is the lowest GPA that someone can get into dental school? I'm not sure. I've heard of like 2.8. I've heard of that. Now I can't confirm it. That's what I heard from a school down south. I don't know. Ray Michelle, just curious your thoughts on root canals. Yeah, no, it depends. And you want to go to an endodontist. They're specialized in root canals. Don't go to a general dentist for that. That would just be my take, right? Nick or DAT, Cyrus, are you getting an MD2? No, I'm not doing the MD. Romandini said 2.9-ish. Yeah. I don't know. HQ said, what's the average pay on a daily wise for OMFS? Daily, anywhere between 1.5 to upwards of 5-6K. This is all pre-tax. Okay. A lot of that money, about 50%, goes to taxes. So that's what it'll be. Two more. User 885. How did you study for the DAT? Dude, all right. I'm recording this, and in the beginning, I went over it. Okay. I would listen to that. This is TikTok Live number 31. So I would go back to user 855. Christian Dean, how do you fix a mandible fracture? We had a patient we had in consult the other day. There's so many ways you can fix mandible fractures. You have open reduction, internal fixation. You have closed reduction. You have conservative management, among a number of others. JFC, big question, doc, regular angled handpiece or straight for the extraction whizzies. We only have straight handpieces in residency, and I hate them. I'd much rather use a contra angle handpiece. You're working on in the back of the mouth, and the mouth doesn't open like a book. It's angles, it's geometry, right? But they want to use a straight handpiece because it has a higher torque. Yes, it does. But Serena said for the NB program, the students get paid for the med school portion. Generally, no. At one program, you do get paid during that portion because you're taking call. Brandy, Michelle, get some rest. Hope you had an amazing week. Thank you guys so much. Wow, 55 minutes.